Hi, I'm Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show. Welcome back to Health Futures, where we explore the people, ideas, innovations, and changing demographics that reshape healthcare and how we care for one another. Today, we're going to talk about something I've spent a lot of time thinking about. What happens in the gaps between healthcare providers? We have great physicians, we have great hospitals, we have great nurses, we have great specialists, but families are often left trying to connect all the dots themselves. My guest today believes there's a better way. Bianca Fabbo, welcome to Health Futures.
Thanks for having me.
You know, I think a really good topic of discussion, if you would, it would be who owns the whole picture, reimagining healthcare at home.
Yeah.
What do you think?
So I believe nurses. So when I was in nursing school, we got taught the nurse is the advocate, and the nurse really owns the entire care of the patient in the hospital. You're coordinating between social workers, caseworkers, the dietitians coming in, the doctors, the 5 different doctors that are coming in, and the nurse is the last person to really be able to touch the patient. So all of that I learned, while I was in nursing school through my training. I worked, in Boston, New York City. And through that training, that's exactly how, I provided care. I'm the last person. I'm the one managing everything. So, when I moved out to Arizona and I saw some gaps that were happening in healthcare, it was just clicked again. I was like, this is the foundation of nursing. The nurses are supposed to be the ones that are connecting all the care. They're bridging the gaps. They're helping the families. Families in healthcare are lost. They have their own lives. They have children. They have grandchildren. There's so much going on. You're working and you have your daily life. And how are we throwing in a healthcare mix when we don't understand what's happening, right? I just bought a house. I had no idea how to even, hang, do the baseboards and all that stuff. And I hired a specialist, right?
Right.
to do that for me.
Right.
And it's like, why aren't we doing the same thing with our healthcare? And nurses really have the expertise, the education, the background, especially if they have the right experience to be able to help people really navigate, all the ins and outs of healthcare, whether it's at home, in the hospital, in an assisted living facility. We really are the eyes and ears at home and as we translate it throughout the healthcare system.
100%. Mm-hmm. All right, so we all know that Bianca's a nurse.
Yes.
And I really want to dive into your background first.
Yeah.
Because you've created this company called Prata Health, and we're going to talk about that.
Yeah.
But I want our listeners and our viewers to know who Bianca Fabbo is. I know you're from Everett, Mass.
Yes.
First generation.
Everett, first generation.
Yeah.
Yep.
So please share with us your journey, from Everett to Scottsdale, Arizona.
Yeah, it's been quite the journey.
Oh, I'm sure it has.
So, my dad is an Italian immigrant. He came to America when he was 16, and his parents really wanted their children to have a better life. So my parents still to this day work 2 jobs. They work their butt off, and that's what they taught us. They were also entrepreneurs. They owned a restaurant growing up, so I learned from a young age not only how to chop parsley, but, what it means to actually, take care of people and to make sure that, the people that we were providing for get the best service. My parents made the best food, the best pizza. My dad still does. And that really, really set me up, I think, for how I am hardworking today. I went to nursing school at Plymouth State in New Hampshire. Graduated from nursing school, and my first job was at a nursing home, and I thought that I was too good for it, right? I was 22 years old, I had a bachelor's degree, and I was like, I can't believe.
Was that in Massachusetts?
That was in Massachusetts, yeah.
Where were you working
in North Reading at Meadowview Center.
Okay.
And it was a skilled nursing facility, and I had 25 patients, trached and pegged, and wound vacs, and some long-term care patients, and hospice. And I had a month of orientation, and they were like, here you go. Use your CNAs, your physical therapist, and, this is what you're going to do. And it taught me a lot. I had to learn on the fly. This is really way before AI and how, Googling things and the whole, 9 yards. And it just taught me a lot. Number one, to use my CNAs, that they are, the certified nursing assistants, are your best friends, right? And they taught me so much, not only from, just a interdisciplinary team, but really how to care for patients. And I think that's something now that a lot of people are lacking, is the basic skills on how to even just approach a patient when you're going to give them a bed bath. I then worked on a med-surg unit at St. Elizabeth's in Boston, and that's really where I had amazing nurses, like the best nurses, teaching me every skill and really how to advocate for my patients. Coming from a nursing facility, it's a little bit different when you have doctors coming in and out, but the nurses that I got taught from at St. Elizabeth's were like, you are the advocate and you're always sticking up for your patients. If you feel like one thing is off or wrong, you're right. And that really resonated with me. It stuck with me. So I then went to work at Beth Israel Hospital on the neuro step-down unit. And neuro is a wild thing. The brain is wild.
Sure.
Yeah. And the brain is my favorite. It's actually probably the best skill set that I learned there. And
What kind of patients were you seeing there? Were
Yeah,
you seeing ALS? Were you seeing
ALS,
Alzheimer's?
Yep. Saw a lot
Parkinson's?
of glioblastomas, strokes, brain hemorrhages. And what really stuck with me is we had a lot of young people, 20, 21 years old, had a seizure and would come in and find out that they had a massive glioblastoma in their head. And how do you care for a person that's 21 with a terminal illness, right? They have their whole life in front of you. And we had a whole array of patients,
How do you not bring that home, Bianca? I
You
mean,
do.
seriously.
You do bring it home.
I mean, you
Yeah.
got a 20-year-old that you know is going to die.
Yeah, and I was 24 at the time. So
Right.
then you go home thinking, this could be me.
Right.
And I think that really just taught me that it's true. Like, you are caring for people how you would want to be treated. And I would just tell them exactly, the doctors would come in and they explain and they do what they do, and then they would leave and the patients would be like, I have no idea what just happened. What did they say? And being able to translate that to them in a language that they understand, even though it's still all English, like, what actually is being said? What do they mean by that? And also giving them the reality, right? Because I think sometimes as healthcare providers, we sugarcoat things. And for me, just, I'm an East Coast person, so I shoot it straight, and it probably gets me in trouble sometimes, but it's so important. Why are we,
Right.
beating around the bush? We need to be able to tell people the truth and be honest with them. So yeah, I saw a lot there, and while I was there, I wanted to learn more. So I actually got a job at Brigham and Women's Hospital on their trauma burn unit. So we were seeing, gunshot wounds and burns after a house fire, and lots of wounds, people that would need to come in and with antibiotics and the whole situation. And that was amazing. So I worked both at the same time. I was young and ambitious and I wanted to learn. And then my husband actually got a job in New York City. So we moved to New York City. I got a job at Hospital for Special Surgery, which is like the best hospital to work at. Love you, HSS. And I worked in the recovery room there. And then COVID happened. So
What? COVID?
COVID, remember that thing?
COVID? Really? In New York?
In New York.
Of all places?
Of all places.
Wow.
Yeah. And I remember, when it first started happening, I was like, oh, this is fine. It's not going to come to New York because you never think it's going to.
Right.
And, yeah,
Did your hospital become a COVID unit?
Yeah, so HSS is an elective orthopedic hospital. So they shut down the hospital, and we became a ICU overflow for all the hospitals in New York City. Our operating rooms became ICU beds, and we operated and we were in the rooms. We had 2 to 3 patients. Sometimes if you were in more of the step down, there was 9 patients between the 2 of you. And we had no idea what was happening. It's very scary because first off, I'm going home to my husband. am I going to have this happen? You know,
Exactly.
I saw my coworkers, you know, sick. We saw coworkers die. I saw, you know, patients dying and coding, and it was the scariest moment, right? You have no idea what's going on. You're in the center of it all. You know, New York City was absolutely wiped by it. You know, it was this crazy experience. And especially in New York City, you know, I then walk the streets home after my shift and there's not a soul around. And you feel like you're on a different planet.
Right.
You know, so
Everybody was hunkered down.
everybody was hunkered down.
Yeah.
And it was, you know, 2, 3 o'clock in the morning, and I would FaceTime families because they weren't allowed to come in the room. You know, they weren't allowed to come in the hospital, and people were by themselves, and people were dying alone. And it was us as nurses that were there, you know, not only keeping them alive.
I can see that it touches you. I mean, still even to this day.
Yeah, it really changed like who I am as a person and as a nurse. I think that what the nurses went through during COVID is like, you know, it's
hard to describe.
It's hard to describe.
Yeah.
It really is.
It is.
And I don't wish it upon anyone. I mean, I'm sure that there's going to be a pandemic at another point in our lives. It's just, you know, that's what's going to happen. I just hope that we're better prepared because we had no idea what we were doing. We were doing experimental drugs and, you know, trying all these things on patients. And, like, your goal as a nurse is to make sure that they get healthy and go home. And that didn't happen most of the time. And that's really, I think, what, you know, broke our hearts the most. But, yeah, changed how I saw my life moving forward. And, yeah, so I went back to school. I got my master's in nursing education. And then I moved on to work in some leadership roles at the hospital. Some of our sports medicine doctors opened a sports medicine ambulatory surgical center, and I managed the preoperative and postoperative nurses there, and it was amazing. Great place to work. The doctors are amazing. I'm still in touch with my coworkers and doctors there, and, you know, amazing place to learn how to be a leader in a very well-oiled machine. So it was great. My husband's job went remote, so we moved out to Arizona, and here we are. We traveled
How'd you pick Arizona?
I didn't want the winter. I hate the winter. I hate snow. I hate being cold. I like the heat. You know, I'd rather be warm than being cold. I don't want to wear a winter jacket. Like, when I have to go home for Christmas, I am just like frigid, and everyone's miserable there because it's been cold and gray for, you know, ever. And they know that they still have 6 months of it. So, yeah. So, yeah, moved out here. I started teaching for a few nursing schools out here.
When did you come out here?
We came out here in 2023. Yeah, January of 23, 24, 25. Yeah, 23. And yeah, I actually was still working remotely for my job in New York City up until this past December, doing things remotely and helping them. And yeah, when I was teaching out here, I started going into, I've been to almost every hospital in the Valley, a lot of the long-term care settings. And I would walk into the rooms and notice huge medical errors. You know, I would just look at the patient and see a medication hanging or things all over the ground and patients covered in soil, and was just like, what the heck is going on here? You know, I was supposed to be there to support my students, and I found myself advocating for patients and found myself getting into disagreements with the nurses and the doctors because patients were waiting days to get like a basic KUB with abdominal x-ray read. I got called in to help my student with a chest chest tube with one of my students' patients, and I was like, great, like, let's see the order, and then we'll go in and we'll handle it. And there was no order in the chart, and the patient had been there for 3 days.
Wow.
And I was like to the nurse, like, what is going on? Like, why is there no order? She's like, oh, well, nobody wants to take responsibility for it. The emergency room doctor put it in, and no doctor wants to put the orders in. And I was just like, call a rapid response. And she was like, well, this is an emergency. I was like, of course it's an emergency. You know, the patient has had a chest tube for 3 days. You know, that is not okay. And that's not what your role as a nurse is. Your role of a nurse is to make sure that you have everything perfect for your patient. It's not just about checking off the boxes, you know, in Epic or Cerner. That's just not what nursing is. It's how are we going into a room and looking at a patient and getting the whole picture, right? It's not just about the orders that the doctor put in or that the respiratory therapist put in or speech therapist. How are we using our assessment skills? And I felt like for the majority of the places I was going, I just kept finding these errors. And it was just like alarming to me.
Scary.
It's so scary.
It's so scary.
And I'm not saying it's like that with every place,
right.
every hospital.
Yeah, imagine the ones you're not looking at.
Exactly.
Yeah.
And it just made me like extremely disappointed in the healthcare system and what it's become and what I thought I was, you know, getting into when I was, you know, 18 years old applying for nursing school. So just not the reason why I came into nursing. You know, I didn't go into nursing to make sure that I, you know, gave all my medications, checked off my things in Epic, and then sat down on my phone at the nurse's station. And not saying that happens everywhere, but it's a majority of the time. And, you know, when patients haven't had even their teeth brushed in 3 days, or you go in and the room is an absolute disaster, and there's soil everywhere and crumbs on the table. It's just like little things like that is what gives our patients better outcomes, right?
Sure.
They look around and they say, oh, everything else is in order and in place. Like, it's going to give me more motivation to get out of bed and walk the, you know, 1,000 steps that I'm supposed to get in today, you know? So there's just like little things that we forget about that really make a huge difference in people's lives. So yeah, so that's kind of what gave me the idea. Long story short.
There's a lot to unpack, what you just shared with me. There's a lot. I've got questions, but that brings us to Prata.
That brings us to Prata Health, yeah.
And I'm going to just hold a tab down on Prata because we'll come back to that because I really want to get a chance to give you an opportunity to talk to me and our listeners and our viewers about the creation of Prata and what you do. But, you know, I guess one of my first questions is there a person or an experience in your early life that made healthcare personal for you to go into nursing? How did you make that decision?
Yeah, so when I was a teenager, I had no idea what to do when I was going to grow up. And
most of us don't.
Yeah, we don't. We have no idea. And, you know, I think you feel a lot of pressure, too, of what your decision is going to be. You're about to go to college for 4 years. I didn't have a choice. My dad was like, I didn't come to America for my kids not to go to school. So I went to college. And
where'd you go to school?
Plymouth State in New Hampshire is where I got my degree from. And, you know, my grandparents raised me and my sisters essentially, not that they did, but my parents worked a lot. They owned a restaurant. You know, they worked multiple jobs even after they sold their restaurant.
But was it intergenerational living or they lived close by?
They lived close by.
They lived
close. They lived close by. And so we spent a lot of time with them. And they were our rocks. They were, you know, part of who we are, and my sisters are to this day. We think about them all the time. We talk about them all the time. And my Nana was really sick. She was in and out of the hospital. She had a lot of medical issues. She fell at home using her walker, getting out of bed. Her ankle completely twisted around, and she went to the hospital, and the orthopedic surgeon was like, we need to do surgery on her right now, like, blah. And
how old was she at the time?
She was 76 years old.
Wow.
And had, like, intense past medical history. And the nurse said absolutely not. Like, she has a huge cardiac history. You know, we're seeing things on the EKG. We're not just rushing her into surgery. She will die. And my Nana was like, I watched the nurse and the doctor dispute right in front of me.
Wow.
And the nurse won. And the next day, the cardiologist came around and was like, thank God, that nurse, because you would have had a cardiac episode in the OR. And when I went to see my Nana that day, she was like, Bianca, there was something about this nurse that just made me think of you. And I looked up to my Nana, you know, and I didn't really know what I wanted to do. So I was like, well, I guess I'm becoming a nurse now. So here I am. So thank you, Nana.
Well,
the reason
I'm
why
sure
I'm here now.
I'm sure she's very proud looking down at you.
She is, yeah, definitely, yeah.
So you went from being a nurse, bedside, and specialist, and then you went and got your master's, and then you went and became part of the faculty and teaching. Mm-hmm. What led you down that role? I mean, listen, you've got some great skills, you know, interpersonality skills, you know, strengths. Did you see that in yourself, or did somebody encourage you to do that?
You know, I think I always had it in myself, and I think like across my different positions, I always got put in like, you know, as charge nurse, you know, as brand new nurse, charge
Boss
nurse.
girl.
Yeah, like I was like, it's just always thrown into it, and like I always got hard patients and multiple of them. And, you know, I'll never forget, I asked one of my charge nurses one time, like, I feel like I'm always getting the most complicated patients. And she was like, well, you're one of the only ones that we trust to be able to handle these patients. And so, yeah, I just really kind of, when COVID happened and we felt like we were on our own island, I was like, I never want a nurse to feel like this. I never want a nurse to feel like they don't have the appropriate skills to be able to handle patients. And that's really what made me go back to school, is I didn't want nurses to feel like we, you know, felt. It was a really scary time, and, you know, we had people to depend on, but, you know, I thought about, too, the other nurses that didn't have the support that we did at HSS, and what were their days looking like. They looked a lot different than mine and a lot more intense than mine. And it was very intense for what I went through, but we had a great hospital I worked at. We had all the supplies. And I think about like the other nurses, you know, especially in New York City, that didn't have that support, have the, you know, accessibility of what we did, and people around the world too. So that's what made me go back to get my master's.
So, and you're teaching nurses. Mm-hmm. And, you know, as we prepare nurses for today, for the healthcare system, we're going to have to prepare them for the next 10 to 20 years.
Yeah.
You know, what do you see in education and teaching? Because you've been doing this not for a long time, but you've been doing it for a while. So, you know, obviously the curriculum and the way you teach, I mean, you talked about AI before. I mean, there's so many new tools. I mean, you think about your days going to nursing school and seeing what you see today in the post-acute and acute settings. It's very different.
It's very different. And I think a huge missing piece of healthcare now is the interpersonal skills. I can't tell you how many students I had that didn't even know how to walk into a room and say good morning to a patient. And that is what is scary. You know, I think especially the generation, you know, coming in, and that is there now, don't know how to sit and have a conversation with people. You know, we're used to being on our phones and the computer. And I think that's also, too, what has really made the checklist so, you know, part of our day. And people forget to be able to sit down and ask basic questions, right? I mean, even when I was teaching, there was a patient that like was not, they didn't know any information about. I went in the room with my student. We sat and talked to the patient for 30 minutes, and we got all this information that we needed, that the nurses that he'd been talking to for a week, the doctors that he'd been talking to for a week, had no idea about. You know, it's just about sitting down and treating people like the humans that they are, no matter where they come from, what they do, what their history was, if they were a murderer, whatever it is, you are still...
You see all kinds.
You
know.
You do. I've taken care of them. You know?
They need health care.
They need health care.
Absolutely.
Yeah. And we have to be able to do that. And I think that is like a huge missing piece, is just being able to go in. And I used to challenge my students. I said, don't come onto that room for an hour. Ask them about their lives. How did they grow up, right? Because sometimes these little pieces of how we are humans and what we've done throughout our life really affect how we take in our healthcare. And I think that's an important piece that we're missing across so many aspects of healthcare, just the basics of talking to people. And I love AI. I use it all the time for my business.
Everybody should.
Everybody should.
Yep.
But I worry about it, you know, being able to, you know, putting this disconnect on relationships and talking to people.
I'm so glad you're bringing this up. This is something I talk about often. Mm-hmm. I've talked about it here on Health Futures. I talk about it from the podium, and I talk about it in my everyday conversations. You know, we in healthcare live in a very relational world, not a transactional world.
Correct.
But AI has promoted a very transactional experience for everybody. So, I mean, you know, we're not selling retail items. We're not, you know, grocery stores. We're providing care, human to human care. I would imagine a lot of the students that you're teaching today were COVID kids. They were the ones that didn't get to go and graduate high school or didn't get a chance to graduate college. They had to do online classes. And I think we're starting to see some of that.
Yes.
And you know, this, and I'm using my phone as a cheat sheet so I can ask you some of these questions, but this here promotes a monologue, not a dialogue.
Correct.
We need to have dialogues, and especially in healthcare. I mean, as a patient, I've got a lot of questions, and I've got a lot of concerns. And you know what? Just asking them in a monologue way doesn't get the response that I'm really looking for. And maybe you just don't know exactly how I'm feeling because you're not looking into my eyes.
Yes.
And you don't see the tears, or you don't see the fear that I have. And you can calm that situation as a nurse and be able to put me at ease by telling me it's going to be okay, and let me tell you why.
Absolutely. Yeah. And I see that too when I go to doctor's appointments with our clients, right? We get 15 minutes with them sometimes, you know, and the clients are going in there anxious and worried. And like what we do at Prata Health is we're, you know, coming up with questions before we know their past medical history. So we know what questions to directly ask physicians. And you're right, a lot of times it's looking at the computer while asking questions to the patient. And I understand we have a limited amount of time with our patients in the clinical setting. But they're still human. They still go home. And for the rest of the 23 and a half hours a day, you know, 7 days a week, like they are still have to manage their healthcare. And, you know, what is happening at home? And that's the most important thing, right? Outside of that appointment that we get, what we're doing at home is really the most important part of our healthcare.
Well, you know, you could have stayed in that traditional nursing role, but you chose to be an entrepreneur. And I often say that healthcare can be incredibly fragmented between primary care, physician, specialist, hospital, pharmacy, home health, home care, and family members. And everybody may know one piece, but who owns the whole picture? And that's the challenge we run into today. You know, I talk about this often. I mean, all you have to do is do the math, right? The 65-year-old population in the next 2 decades is doubling. Yeah. The 85-year-old population is going to nearly quadruple. I'm not so worried about the 65-year-old population because next month I'm going to be 64, and I think we did a better job of taking care of ourselves.
Yes, I agree.
But the 85-year-old population has multiple comorbidities.
Oh, yeah.
And they are seeing multiple doctors. I mean, my dad, in his final couple years of life, had 14 doctors.
Yeah.
I mean, how do you manage all of that? So that is a big challenge, and I have to believe that may have been the impetus for you to say, you know what, it's so freaking fragmented.
It is.
I need to be that quarterback for families, because you probably saw that in the acute patient setting.
Yes, yeah. I mean, people have 14 doctors. You know, they're on 35 medications, and you're like, what? Why is, you know, this 85-year-old patient on 35 medications, right? Can we eliminate some? Half of them are, you know, interacting with each other, right? But we go to physicians and they are specialized, right? They have their specialty, and that's great, because if I have an issue, I want to go to a specialist, right? But oftentimes, you know, we are prescribing the medications that we prescribe, you know, people for, you know, these diseases or whatever is happening, and we're not looking at the big picture, right? We're focused on our specialty. We're focused on the heart. We're focused on the lungs, and which is great, but what about the rest of the body? And that's exactly really what helped bring my idea for Prata Health is, what is the big picture, right? And I think that's why it's so important. Like on my team, I have a pharmacist, I have a dietitian. I think those are two of the most underutilized roles in the healthcare system.
Well, and it's, I'm sorry to interrupt you, but I mean, the second one, the dietitian.
It's huge.
The epidemic that we're dealing with is diabetes. I mean, it's incredible how many people have diabetes.
Yeah.
And you need a dietitian to be able to manage your meals, manage your intake of insulin, all of that.
All of it, yeah. Yeah. It's wild, right? And it's wild, too, the regulations that we have from state to state on who gets to manage that. Because a lot of times it will be somebody that took like an online nutrition course, and now they consider themselves a nutritionist.
Wow.
And for me, I really believe that like the higher education that dietitians get is so valuable, you know, even if it comes to, you know, managing what percentage of calories they're getting in a tube feed, right? Or exactly how are we teaching our diabetics how to eat properly, right? They're going home with paperwork from the doctors. I'm sure they're getting nutrition consults as well too, if you're going to a great, you know, endocrinologist. But what is actually happening at home, right? Mm-hmm. Even though you're getting the paperwork and all that stuff, how are we teaching people at home to live that healthy lifestyle? And that's exactly what we're doing, right? We are taking what we have, our expertise from our dietitian, and we're translating that into the home setting. We're teaching our clients how to grocery shop, how to cook food the proper way. Because a lot of times what you think is, and I learned this from my dietitian, you know, you think you're eating broccoli, so you think you're eating it the right way, right? But the way that it's actually cooked is the way that the most nutrients come out. And that's something that...
You mean microwaving isn't a good idea?
Yeah.
Imagine it just kills everything.
So especially when there's butter on it. But but there's
it tastes so good.
I know it does. I love it. You know, I'm Italian, so don't even get me started. But
with
you know,
the butter.
Yeah. So yeah, I just think that there's just so much. It's like anything, you know, there's so much about our phones. I wouldn't know how to do anything or manage. I still barely know how to work my phone, you know, so why we need those experts to really sit down and spend the time. And at home is really where it happens, in my opinion.
100%.
I think that the way that we're living our everyday, the way that we have our schedule and our routine really matters, and understanding the food that we're eating and actually understanding it, even understanding how to food shop is like a huge deal.
100%.
You know,
all of that.
And
I need help with that.
Yeah.
Seriously.
I know. Most
Nothing
people
in boxes
do.
and cans, right?
Yeah. I mean, you know, I think it depends, right? I think you need to be able to indulge and live, and still, you know, I love a brownie, but like...
And I love ice cream.
Yeah. But, and we're allowed to have those things. But
gelato.
Like, yes, I love gelato. Who doesn't? And yeah, but if you are not, you know, for whatever you have going on and to prevent diseases, you know, our nutrition is the most important part.
100%. Mm-hmm. So, you know, before we jump into Prata, you know, just to set the table, where are patients most vulnerable to things falling through the cracks? Because that's really what we're talking about. This is how Prata came to be, right? Is that people are falling through the cracks. Hospital discharges, medication changes, multiple specialists, we talked about that, chronic disease, cognitive decline, and family members living out of state. Mm-hmm. How much of this is really the impetus for you to say, you know what, there's a better way.
Yeah.
I've got to do this differently. So I'm kind of setting the table.
Yeah.
I really want you to take me through, and our listeners and viewers through, the creation of Prata Health. And what is Prata Health?
Yeah.
What do you guys do? And how did you come up with the name?
Yeah. I think all of that is the reason why I created Prata Health. I mean, I spoke to somebody actually this morning before I came here, who called me with all of those issues. She lived out of state. Her mom has a cognitive decline. She's seeing multiple specialists. She lives in an independent living facility, but she's still sitting and watching TV all day. And they want more for her, right? What can we do to really help people live their best lives, right? I think a lot of times, too... And she's
solo aging.
Aging, yes. Her husband passed away about a year ago. Yes. And, like, that is a lot of our population, right? They're solo. They are, you know, living alone, and you know, whether their children are
our
here,
population, 65 and older, lives home alone,
and or their children live in another state, you know, and that is really loneliness is really what is, I think, rapidly increasing our cognitive decline here. I think there's a lot of other things, obviously, but I think being lonely and not having, again, back to routine and doing the things that we were continuously doing, especially when our significant other passes away, right? You go into a, you know, depression and you're upset about things. But yeah, so yeah, Prata, My dad grew up in a small town right outside of Naples, Italy, called Prata PU. So
such a pretty area there.
It's beautiful.
It really is.
Just mountains and greenery and like the most amazing food in the entire world. I'm sorry, anybody else? My husband thinks Northern Italy has better food. I disagree. But I also grew up on Southern Italian food. So, so in Prata, family takes care of family. And, you take care of your loved ones. You take care of your grandparent, whether they have some kind of cognitive decline or had a stroke and are no longer able to walk. That's what we do. Anytime I've been to my dad's hometown, I've watched my aunt take care of her, my great aunt take care of her mom, right, that had a major stroke. And she was the full-time caregiver for her mom, right? Her mom couldn't move. She was in bed. And she took care of her with love and compassion. And, walking around the streets of my dad's town, too, you see the elderly population and their loved ones taking care of them. And for me, that's how I was raised. Your family is the most important thing. Doesn't matter what else is going on. And you take care of your family and you love your family. And so when I was starting Prata Health, that's always how I gave care to my patients. Again, didn't matter if you were a murderer or a billionaire, right? I always cared for my patients like I would my family members, like my grandparents. How would I want them to have care provided? And also, too, like when my grandparents were passing away, we didn't have a service like Prata Health, right? We were a family trying to figure it out on our own. And
like most families,
yes. Right? And so when I saw, what was happening and how healthcare is changing, it was all these different occurrences throughout my career, throughout my life, how I was raised that really resonated with me. And I knew that I wanted to create a company that the families are our family and vice versa. We're getting invited to grandchildren's, graduation parties and big life events. And they want us over to be sitting with, at dinners and conversating with us. And that's what Prata Health is about. It's about becoming part of someone's family so that way when your children live in a different state, you have someone to depend on. You have a concierge nurse that knows everything about your parent and their medications and what's going on, or somebody that has, a cancer diagnosis. You have one nurse, that really understands everything, your entire past medical history. They understand how you live at home, how you want to live at home, what your hobbies are, and really are creating care around that to be super personal. And so we care for our families, like family. And it's just what we're doing, it's a passion. And, when
I can feel that. I mean, I know, I totally feel if coming from you. I mean, the aura is very positive and very strong. And you did a great job of really defining not just Prata, but concierge nursing.
Concierge nursing, yeah.
Because that's what we're really talking about.
Yeah. So
an advocate for the family.
Yeah.
Like family, right? We are like the family.
Yeah. Yeah, we become family.
Especially for those solo agers.
Absolutely, yeah. And I think that concierge nursing is used very loosely. And I think that, concierge nursing is not just having like a roster of nurses and they're going in and out doing the skill, right? Concierge nursing is having a dedicated nurse that knows, again, everything about you, your past medical history, knows which child you like better, which medications, how you take them, when you need a refill, what appointments are coming up, what type of activity, I call them activity assistants, my CNAs, will be best in their home, knowing if they need 24-hour nursing care, which nurses are going to be best in that home. And that is who is managing the day-to-day, is that concierge nurse, with our clients. I know what's happening in my clients' homes at 4 o'clock in the morning or at 2 a.m. We know everything that's happening, and
Sure.
we're becoming a part of the family. And that's what concierge nursing is. Concierge nursing is not going in and providing skills. That's a skilled nursing, right? And we need more concierge nurses. You know, we need more concierge nurses to be able to have the skill and the understanding of what is happening in the entire picture. It's a full picture. It's not just going in, doing the skill, or seeing them in the hospital, or just taking them to a doctor's appointment.
It's the whole person,
it's
not
the whole
a task.
Person. It's not a task.
It's not a task. It's the whole person.
It's the whole person.
100%.
Yeah.
And you know, it's interesting. You talked about matching people, and I think that's really important too. Is matching whether it be the nurse or CNA to a patient that is one, not only got the skills, and that's the important thing, but also the relationship. You know, is it somebody that is very relational and wants that, or somebody that just wants someone to do tasks and just be done?
Yeah.
Right?
Yeah. And I tell people too, like, if that is what you're looking for, Prata Health probably isn't the company for you, right? We get very involved, and that is the purpose of it. We have people that want this family connection, that want us to be involved. They want to know about the people that are coming in and out of their home, whether, you know, they had plastic surgery, or they had an orthopedic surgery, or they're aging in place, right? They want to know that they can trust the people coming into their home, and that the people that are coming into their home are going to love them. And I think that's a really important piece.
So I'm going to ask a couple hypothetical questions.
Okay.
So let's say I have an 82-year-old mother. She lives independently, has several chronic conditions, takes 8 medications, not 32, sees 4 specialists, and her adult children live in different states. How would Prata Health enter into this picture?
Yeah, so Prata Health actually goes in, myself or one of my concierge nurses, we go in and we do a complete dive on the person. We go in, we do an assessment on them. Not only their past medical history, not only their past surgical history and their medications, but we dive into, you know, every single record. We're looking through from 5 years ago, what, you know, happened at the hospital. You know, did they have a UTI a few years ago? And these are the medications that worked for them. This is not what worked for them. We are asking about their hobbies, what they liked to do when they were younger, you know, how they like their home to be kept. What kind of foods do they like in their refrigerator? What type of games do they like to play? So that's where it really begins. It's really taking like a really deep dive, and then bringing in the family and saying, how do we want care? And it's a very, you know, open conversation between the parent and the children. How do we envision care to be? What are your goals for the remainder of your life? How active would you like to be? You know, do you want to go to the botanical gardens with our activity assistants every week, or the art museum? You know, do you want to go get a manicure or pedicure? Do you want to go to the Phoenician and have afternoon tea? You know, what's going to bring you joy to make sure that you're living to your fullest potential? And that's really how the conversation starts and begins. And then we really are, you know, assigning care based on that.
I love how you describe that. Really, really well. And I can visualize that. So what role does Prata play in physician appointments?
Yeah, so for physician appointments, we actually, again, we usually know all of our patients' past medical history, and there's usually specific things that our clients are going into those appointments with, right? But a lot of times, especially with our seniors, honestly, even with myself or someone, you know, that is at any age, goes in the appointments and they forget all the questions they were going to ask, or that they forget that their big toe is bothering them, you know? So we actually come
That happens.
It happens. Of course it does. I've left a doctor's appointment and been like, oh, crap, I meant to ask them that question.
Exactly.
But yeah, so we write down a whole list of questions that we save for the end of the visit. So the physician goes through all of, you know, their questions, their examination. If any of the questions haven't been answered, then we then go ahead and ask all the questions that we need. We're writing everything down. And then actually after the appointment, we do a write-up of everything that happened in the appointment. And then we sit down and we talk with the patient and their loved ones about the appointment, what happened, what the next steps are, and what like the actual treatment plan is. And then we make sure that the treatment plan that the physician has, you know, encouraged us to do is actually being followed through. Because, you know, a lot of times we go home, we throw the discharge paperwork.
You mean you make people accountable?
Yes, imagine that.
Wow. All right.
Yeah. So
I need you guys to come to my doctor's appointments.
We'll be there.
No, but true. I mean, if you're not going to follow through, then what's
happening at home? That's the most important thing.
Exactly.
Doesn't matter if they told you to take metoprolol. If you're not going home and following everything else and, living the life, to be healthy, and are we changing the dressing, every day? Are we doing it in a, as clean of a way that we can? And most of the time the answer is no. So we are actually making sure that the treatment plan that the physician has prescribed is actually being followed through with. And that's just part of what we do.
Thank you for that answer. That was perfect. So medication management is a huge issue for older adults. What problems do you commonly see with that?
I commonly see similar medications prescribed or medications prescribed that shouldn't be prescribed necessarily. And the similar medications prescribed is really something that kind of bothers me because,
it's like putting a Band-Aid on the wound, but not curing it.
Yes.
Fixing it.
Yeah, and not giving the support that we need again at home. And a lot of times I see that my clients are like, oh, I don't know what that pink pill is for. The doctor just told me to take it. And I'm just, it infuriates me. I'm like, what do you mean the doctor just told you to take it? We need to know what every pill is being taken for. We need to understand the medication, understand how it works, when the peak, time is on it. And, do I need to take my blood pressure an hour later to see, if it's decrease my blood pressure?
Right.
There's so many things that is not being taught education-wise for patients and with their medications, and it's something that we really try to do. We had a client leave, the hospital a couple of weeks ago and got prescribed all these new medications, and he was like, I have no idea what half these medications are, and it took multiple days of one of my nurses being there for like an hours of educating on what the medication's for, knowing exactly what pill is for, what time to take it. And I think that is like such an important piece, is like understanding. I even think about my dad. He called me a few weeks ago. I was like, oh, they started me on this medication. I was like, why? He was like, I don't know. I was like, well, you didn't think to ask the question? Why didn't you call me?
Right.
So, it happens. And, I understand healthcare is fast and it's moving and only a certain amount of time, but that's really where, companies like Prata Health really are such an asset, because we're able to sit down, we have the time to explain medications and explain what could happen, for them.
This generation that we're caring for, not mine, mine's the boomers, they're coming into it, but the greatest generation, the silent generation, was such a pill-popping generation. They had a pill for everything, and just take the pill. I mean, this November will be 4 years I lost my dad, and my dad had congestive heart failure, and we all knew that, but I don't think he quite knew he had that. And then when he discovered he did, do you know what his question was? Do they have a pill for that?
Yeah.
And sorry, they don't have a pill for CHF. Yeah. They don't have a pill for COPD. They don't presently have a pill for dementia or Alzheimer's or ALS or Parkinson's. It just doesn't exist. There's not a pill for that. But there's ways, and there are things that you are doing as a concierge nursing organization where you are getting people to live their best lives by eating better, by adhering to the doctor's discharge orders, making them accountable.
Yeah.
The one piece that I really like is the fact that you are, working with pharmacists, dietitians, and other professionals to create a personalized healthcare plan for that individual, and really create a healthcare team for that individual.
It's exactly what it is. And we work alongside physicians. We have relationships with concierge doctors, and when we meet doctors as well too in appointments, try to really get to know them and understand them. So that way, if there is an issue, we're all on the same page and we can connect with them. And another big part of what I learned in nursing school is that your interdisciplinary team is so important. And I think healthcare has really strayed away from that, right? You go into the healthcare system, oh no, that person's responsible for that, and that person's responsible for that. But no, we're supposed to be working together as a team, and it's not about who's responsible. Of course, everyone has their roles and responsibilities, but we are still all accountable, and having this interdisciplinary team that like I've created is so important, right? Even with my CNAs, if they're in clients' homes and they notice the client's a little bit off, okay, well, let's send a nurse there, right? Let's do a head to toe assessment. Let's see what's happening, and then we get to talk with their concierge doctors. This is what's happening. Do you think we can get some blood work done or a urine test today? It's just like simple things that prevent hospital admissions, or readmissions, prevents death, so it's really important for us to work together as a team, and there needs to be more of it. It's not like a solo situation in healthcare. That's not what it is. We have to work together.
I have a whole section here on aging in place, but I'm going to skip over that just because I want to make sure we dive into a couple other things.
Yeah.
But aging in place is something that you definitely advocate. And as you're sitting here talking about, maybe doing a urine test and others, a lot of people don't realize that we can do diagnostic testing at home. You don't need to go to SonorQuest, or you don't need to go to LabCorp.
No, they come to you.
You come to you.
Yeah.
They can come to you for diagnostic testing, x-rays, dental work, you name it.
You name it, yeah.
You can get all of that in your home.
Yeah. And I think that's a great evolution of healthcare.
100%.
Right? We don't have to go, if we have a client that is wheelchair bound, or bed bound, they don't have to leave their home to get the healthcare that they need.
I gave you the math earlier. We can't build enough facilities. We can't build enough hospitals. I see a world where home has to be the center of care.
It has to, yeah.
It has to be the center of care.
Yeah.
And having, concierge nurses like Prata Health, and having concierge physicians, and having diagnostic testing and other testing being done at home just makes a lot of sense.
It does, yeah. We just recently, too, had a client, an aging in place client, that was diagnosed with Lewy body dementia, and it was difficult.
Oh, it's a hard
Very
disease,
hard.
yeah.
And, my mentors were like, oh, well, just tell the family, put her into a memory care unit. And that's not what the client wanted.
Yeah.
And that's not why I created Prata Health. Did not create Prata Health for any patient that was difficult to go into a memory care unit. Those are things that we can handle at home when you have the right people trained to do it, and people that are going to give that person still the love and, the care that they deserve. And that's very important. Just because it's a difficult case doesn't mean that they automatically have to go to a facility, right? We are able to provide that care at home. It's a higher level of care, of course it is, but we have the right people that are trained and that can provide that care. So yeah, there's not going to be enough facilities. There's not enough, nurses and CNAs to be able to even, staff those facilities. I've worked in nursing homes, as my first job. I worked, out here with students with them, and they're understaffed.
100%.
The patients are getting changed once a day. They're sitting in their soil, and the rooms are a disaster. And, there's just only so much that they can do, and it's really a disservice to people that, that don't have the ability to stay at home.
100%. I couldn't agree with you more. I mean, we do have a staffing issue. We don't have enough people getting into healthcare. So my PSA to our listeners and our viewers, healthcare is a great place to be. There's a great need for healthcare workers, and you don't have to be a clinician. You can be a lot of things in healthcare. You can be a data scientist. You can be an administrator at a long-term care facility or an acute provider, a hospital. There's so many things.
There's so much to do.
So much that we can do.
Yeah.
So much. I know that you're a Suns fan, and I know that, or at least I think you would agree that nurses ultimately could be that point guard for older adults, especially with complex needs, because there's no better advocate.
Yeah, we are the point guards. We are the quarterbacks
Yes.
of people's healthcare. And that's what we say all the time. You are hiring a quarterback to help you manage the game of your life, right? And that's what we're doing. And it's so important to have that point guard, to have that quarterback in your corner. We all have somebody that we depend on, right? You, I'm sure, depend on your wife. I depend on my husband. And when it comes to our healthcare, we sometimes need somebody else to depend on, right?
Listen, I'm talking about solo aging, right?
Yeah.
So I may have shared this with you. I had back surgery. I had a herniated disc. And for 2 weeks, I could not bend or twist. And if I didn't have a partner, I didn't have my wife, who we're going to be married 37 years in October,
awesome,
helping me get dressed in the morning, I don't know what I would have done. I mean, she had to put everything on for me.
Yeah.
Everything from my underwear to, buckling my pants and tying my shoes. That's just the way it was.
Yeah.
I mean, because if I bent, if I twist, I would have
undone
the surgery.
Outcome.
Yeah.
Yeah. And we need people that know what they're doing, right? And
exactly.
And your wife you're lucky you had your wife. A lot of people don't.
Exactly.
Right. And so
I'm almost 65, and I could be that 1/3 that is solo aging, right?
I hope you're not. But
no,
knock on the wood.
I hope I see 65.
Yes,
I just don't want to be solo aging.
You will.
So I want to take our conversation into entrepreneurship. Okay, so nurses are trained to care for patients. They're generally not trained to build companies. How difficult was it for you to transition from a clinician to an entrepreneur?
I think it's probably been the most difficult thing I've done in my life. It is not easy. It's still not easy, and I'm almost 2 years in. You are trained exactly to be a clinician. I didn't take business courses. I've never did like a marketing course. That's just not what my education is in. Mm-hmm. And so it's difficult to change your mindset, right? Because as a nurse, you want to change things and really help your patients that you have. But then you also, for me, it's, being a leader and being, the CEO of a company, right? And switching that mindset in my head is very difficult. It still is to this day, because I'm just like, I want to go and provide the care all the time, but I can't do that.
Right.
But for me, it's important I've trained people exactly how I want care to be given, and that's important, right? So I know the quality of care that I provide, and teaching that to the people that work in my company. I couldn't do it without my team. Like, they are the best nurses and activity assistants. They are like there's nobody better. And, but it's finding the right people, and I think that's really important too. And yeah, being an entrepreneur is probably the best thing I've done, and more people need to do it. And it's not what I thought I was going to be doing,
right.
11 years ago when I got out of nursing school, but just because of what I've seen and what I've learned over, the last 11 years has transitioned me into this role of what needs to be done in healthcare. We need to make changes. We're not making enough changes. And if you think that you can make a change, then you should be becoming an entrepreneur and helping people and making a good change in the world.
Being an entrepreneur is a very lonely existence. Mm-hmm. And sometimes you got to make really hard decisions. Was there ever a moment that you said to yourself, what did I get myself into?
Oh, yeah. Yeah, that happens. And, I think it happens frequently, right? And I think as entrepreneurs, right, we have, this, we always want the best, and we want to really put what's in these brains of ours out into the actual world. And it's difficult sometimes, for people to see your vision and see, especially when I started Prata Health, I didn't know anybody in Arizona. And, I spent most of my time out there educating people about what the company was going to be and what it has become. And that's a lot of what you need to do, is educating people what your idea is and how, making sure that you are staying true to yourself and not listening to all the commotion around, because it happens a lot. It makes you have those thoughts of, what the heck did I get myself into?
Sure.
But you have to remember why you did it and really just run with it.
Do you have a mentor or somebody you bounce things off of? Is it your husband? Is it, one of your former colleagues or teachers? I mean, like I said, it is lonely, and we all need that safety
lonely.
valve.
Yeah, I definitely throw a lot of ideas off at my husband. I mean, he is my rock, and sometimes I think as entrepreneurs too, you have all these thoughts in your head, and sometimes somebody has to tell you, it's chill out a bit. So yes, him. And I actually have, mentors with different physicians as well too, that I have met along my way, in different CEOs, that I really bounce certain ideas off of them and ask them for their opinion. And I think that is so key, is having people that you trust to do that. because you can't trust everybody. You know, there's some people that,
yeah.
whatever, but, actually finding those people and not rushing to find the people that you can trust to help you make decisions. I think it's really important to find the right person, and that's more important than rushing and finding the wrong person.
100%. It's hard to believe it's 3 years. You've been here for 3 years, since 2023.
Yeah.
And you've established this company. And how many nurses do you have? How many employees do you have?
Yeah, there's about 20 of us now.
20.
Yeah.
20 team members of Prata Health. So 5 years from now, what would you like Prata Health, or the concept of Prata Health, representing concierge nursing here in our community? What would you like to see it look like?
Yeah, so Prata Health will always be a boutique company. The goals for the business is not to be the biggest, it's to be the best and the highest quality. I'm been training a concierge nurse and waiting to find the right nurses, because even though you're a nurse doesn't mean that you can be a concierge nurse, right? And finding the right nurses, I should say, to be able to fill that role, right? And I have found, somebody now that I'm training into this concierge role. And so the goal is to have, at least 5 concierge nurses to be able to manage and handle the rest of our patients, and as we continue to grow. Just continuing to find the right team that's passionate about what we're doing, and really, building it to be still the highest quality, and not rushing to build it, and not just, hiring people just to get, business. So.
Critical mass, yes.
Yeah.
Absolutely. Love for you to make a PSA. Feel free to look into the camera and say, if you're a nurse that wants to experience concierge nursing, I mean, you do it right here in Health Future. Seriously.
I think it's really important for nurses that want their career to be important and make a difference and love their patients the way that they love their family. I think a lot of people can say that, but do you have the passion behind you? Do you have the love in you to, care for somebody like you would your own? And I don't think that every nurse has that, but there are many nurses out there that do. And if you do, please reach out to me, because we are hiring, and we don't hire just anyone. We've had hundreds of nurses and CNAs apply for our position, and you don't get hired just because you have a job title or the education. You really need to have the heart and love behind it, and not everybody does, and that's okay. But, if you want to be part of a company that is really making a change in our clients and their families' lives, where they're depending on us, then you should be a Prata Health nurse. And, send us your resume. And
how do they do that?
Yeah, they can just send their resume to info@pratahealth.com, and it's Prata with a T, not a D like the purse. And they can send their resume, and then my nurse educator will reach out to them if they are a good fit.
I love it.
Yeah.
All right, so this is the part of the program that we get a chance to experience the maybe personal side of Bianca.
Yeah.
I do these rapid fire questions.
Let's do it.
So, I haven't prepared you.
Okay.
So you ready?
Yeah, I'm ready.
And they do require one-word answers, but you can elaborate.
Okay,
I'll give you that opportunity.
I'm a long speaker. Yeah.
Hospital or home?
Home.
Technology or human touch?
Human touch.
Of course it is. One healthcare problem you would fix tomorrow if you could?
Quantity over quality. Or quality over quantity, sorry.
Quality over
too much
quantity.
of a quantity in healthcare, and it needs to be more about the quality.
Yeah, and I'll throw in one. Better discharges.
Yes.
Better discharges. Yeah. What's the most underrated profession in healthcare?
Dietitians.
Oh, I love that. Mm-hmm. I love that. One thing every family should know before a parent is discharged from the hospital.
Did the nurse spend more than 10 minutes going over your discharge instructions with you? Because if they didn't, you need them to come back.
One medication mistake families should watch for?
Too much medication, especially when it comes to opioids.
One warning sign with an aging parent that people too often ignore?
Confusion.
COVID, ICU, nursing taught you?
Resilience.
Teaching nursing students taught you?
Patience.
Harder job, being a nurse or being an entrepreneur?
That's a good question. I think being a nurse. Being an entrepreneur, you are in control of your destiny a little bit, and you get to take the experiences that I've had as a nurse to form a business that I'm proud of.
Okay, I love that.
That was not one word.
No, that's okay. I told you could elaborate. Best quality a great nurse can have?
Compassion.
One word that describes the future of nursing?
One word that describes the future of nursing. I would say resilience.
One piece of advice for a young person considering nursing?
Do it. It's the best career. There is nothing like going home at the end of the day, even if you had a hard day, knowing that you made a difference in somebody's life that day. And that's what keeps us as nurses going.
One piece of advice you would give a nurse that is considering entrepreneurship?
It is worth every struggle. It is worth people telling you that your idea isn't good. It is so worth, just getting out there and doing what you're proud of and what you have learned to every point in your life to make sure that you are fulfilling your duty on this earth for the time that you have here.
Who has had the greatest influence on Bianca Fabbo?
My parents.
Something people would be surprised to learn about you?
Ooh.
See, I told you we'd learn the personal side of you, too.
I know. I'm obsessed with my dog. Obsessed.
What kind of dog?
I have a boxer, and
They're adorable.
They're so adorable.
And what's his or her name?
His name is Manny, and when I was a COVID ICU nurse.
Manny, I like
Manny,
it.
yeah. Yep. And I was a COVID ICU nurse, and it really affected me mentally. And, a dog really is what helped, calm me down in anxieties. And I think that's something, too, that we don't talk about enough in healthcare. And I know this is off topic, so I apologize.
No, this is good.
But taking care of yourself as a nurse and as a healthcare provider is so important. I exercise every day, and I try to eat healthy and spend self-care. And, whether, we have an animal that helps you with that, I think it's so important. Like, we are so consumed with taking care of other people that we sometimes forget to take care of ourselves, and we are the most important. Like, I cannot take care of my clients if I'm not myself 100%. So.
I really appreciate you going through that. And for me, I walk my dog every morning.
Yeah.
Ruby's my yellow lab, and we were out for 2.5 miles this morning.
Love it.
And that's a shorter walk.
Yeah.
We usually go at least 3, but it's important.
It is.
And as much as I think I'm doing it for her, she's doing it for me.
Oh, absolutely.
She's totally doing it for me.
When I take my dog for hikes, he doesn't want to be on that hike. He's doing it for me.
So what keeps you up at night?
What keeps me up at night is knowing that there's people out there that don't have a nurse to be able to support and take care of them. And I hope that concierge nursing continues to be a thing, and entrepreneur nurses keep building companies, and that we keep helping the people that are out there. And, we need to just take care of people.
So what gets you out of bed in the morning?
Knowing that I have somebody waiting for me.
Mountains or beach?
Mountains. And I grew up a beach person. I'm from the East Coast, but there's something about the mountains. You're driving around and the sun is hitting the mountains a certain way, and it's just like a calming energy for me.
Coffee or tea?
Coffee.
Coffee for sure.
Oh, yeah. Espresso on ice. If I could put it straight in my veins, I would.
Finish this sentence. Healthcare would be better if we just...
Listened.
Finish this sentence. Aging well means...
Happiness.
Final question. I feel like we're on Jeopardy.
Yeah.
Final question here. Bianca, you've cared for people in hospitals, ICUs, surgical settings, and now in their homes. You've taught nurses, led nurses, and built a company around nursing. After everything you've experienced, what does the word care mean to you today?
Yeah. Care means to me, again, I know I've been using this word a lot, but just love and providing the love that you would provide yourself and your family members to provide that care. Because if you don't have that love in you and that compassion, then there's no point for you to go into work that day, if you can't fully give somebody your true heart.
I love that. I wish everybody was in this profession of healthcare for that reason.
Yeah.
So Bianca Fabbo, founder and president of Prata Health, thank you for joining us here at Health Futures.
Thanks for having me.
And for the work you are doing to rethink how we navigate healthcare and support people where so many of us ultimately want to be, at home. And to everyone listening, thank you for joining us here today. And I want to just leave you with this. Is there a question I haven't asked? Or is there a thought you want to leave our listeners and viewers here today?
I just think if you are struggling with your healthcare or a loved one is and you don't know where to turn, not only reach out to Prata Health, but, reach out to another company or reach out to somebody that is going to give you what you need. I live life with joy, and I think when things bring me joy, that's how I'm a better person and, fulfills my cup. And, if your healthcare is not bringing you joy, give you a call, right? We have people to be able to help you have joy in your life again.
One more time, how do people reach you at
Yeah, so they can
Prata Health,
call me at 480-404-4737. They can go on our website and inquire or send us an email at info@pratahealth.com. They can text us, whatever is easiest for our clients. We make it as easy as we can for them.
Bianca Fabbo, thank you for joining us.
Thank you.
And I really will tell you, our community is so much better off having people like you that care and love the work that you do. And thank you for our listeners and viewers for being here on Health Futures. We're going to make this a wrap. We'll be back next week. Thank you.
Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.